Thank you, Deputy Speaker. I thank the member for Lalor for the opportunity to speak on this very important issue. As a former doctor and a medical researcher, health is very close to my heart, and it is one of the most important issues in the electorate of Kooyong. At the last federal election, both of the major parties offered an extra $7.9 billion in funding to Medicare to boost bulk billing rates. Now, $7.9 billion is a lot of money. I wholeheartedly support the concept of universal health care. I support Medicare and I support bulk billing. But throwing more money at the system without addressing its structural issues simply is not going to ensure that all Australians can see a GP without paying out of pocket. Last financial year, 77% of GP services in this country were bulk billed. A metropolitan GP who bulk bills every patient earns about $50,000 a year less than someone who undertakes bulk billing, mixed billing. That's a big gap, especially if you factor in rising overheads, staff wages and the complexity of care. The government's new bulk billing practice incentive program offers a 12.5% quarterly bonus for practices that bulk bill all of their patients. But more than 90% of GPs are telling us that even with this incentive, exclusive bulk billing may not cover their rising operational costs. The fact is that both the current and the proposed bulk billing models incentivise shorter appointments. Essentially, they promote 6-minute medicine. The longer the consult, the worse the remuneration under Medicare is. This disadvantages those GPs who are undertaking important chronic disease management, those people who specialise in women's health or in mental health. In rural areas, practices face a number of additional challenges, which include workforce shortages, geographic isolation and fewer resources. At the same time, Deputy Speaker, we're facing a growing shortage of GPs, especially in rural and outer suburban areas. Young doctors are choosing other specialties because general practice is undervalued and under-supported. If we don't make general practice a viable, respected career path for young doctors, no amount of funding is going to ensure access to bulk billing. We have to give GP trainees the same pay and conditions as young doctors who are training in hospitals, and we have to create more GP training positions. Deputy Speaker, Medicare is just one piece of our healthcare puzzle. We have a situation where we have fragmented and disconnected services and a lack of coordination between primary care, hospitals and allied healthcare. Our public hospitals are overfull. Their infrastructure has not kept pace with population growth and with ageing demographics. They're facing a dual crisis of increasing demand but decreasing productivity. Hundreds of thousands of Australians are currently waiting for planned surgeries. More than 1/3 of people wait longer than recommended times for essential procedures like heart valve replacements. We have a situation where ambulance ramping remains a critical issue. Lives are being lost in ambulances because we can't get people through the doors of our hospitals. The government's new urgent care clinics aim to provide free walk-in care for non-life-threatening conditions. Theoretically, that should ease pressure on emergency departments, and that is a worthy aim. Already, over 1.2 million Australians have accessed urgent care clinics, but there are legitimate concerns about them. They strain the already limited GP workforce, they divert funding from existing practices, and they potentially, consistently, plausibly undermine continuity of care. The Albanese government has already spent $1.3 billion on urgent care clinics without any significant evaluation of their outcomes or their cost effectiveness. Deputy Speaker, the government is investing billions to expand bulk billing incentives, but we need it also to address GP remuneration and training numbers, practice sustainability, hospital capacity and workforce retention. We need real reform of our healthcare system. We have to invest in digital health, in integrated care and in preventative services. We need to simplify Medicare. We need to introduce item numbers that reflect the realities of modern medicine. We need to pay doctors for providing the very best practice care, not just for seeing patients quickly. Investment in healthcare is the very best investment that we can make as a country. I urge the government to stay the course and to make that investment wisely.